No matter what shape your skin is in.
Hello, welcome to our Q&A session. Today we'll be answering the question of the duration of action of some of the muscle relaxants injectables that we give, the ones that are commonly available in the United States are Dysport and Botox. So how long do they last when you inject them? This touches on cost, so that way you can calculate how much you'll have to spend on Botox or Dysport every year. Also touches on convenience, how often do you have to come in for the injection, because these factors put together can affect one's decision to even start the process or not. Generally, the cosmetic Botox that we inject for the sake of wrinkles will last anywhere between 3 and 4 months. So generally we just say 3 months. The same thing goes with Dysport. Botox and Dysport are similar in many aspects. That said, there are individual variations depending on how your body interacts with the botulinum toxin by way of breaking it down, formation of antibodies to the toxin. Your duration of action, of activity, of effect might be shorter or longer than what has been mentioned earlier. The answer is not written in stone, and there are individual variations. That said, if it's discovered that, say, you've been getting Botox injections and you've been consistently getting shorter duration of action than expected. So for instance, instead of 3 months, your muscle activity returns in, say, 2 months or even less. And this is despite having injected the right concentration and amount of Botox for the indication. In that event, we'll have to start looking at the possibility of maybe you've developed antibodies to the Botox and you're breaking it down faster than is hoped, and that may account for the reason. What is recommended at that point is to switch the type of Botox that you get injected. So if you've been getting Botox, that's the time to now start considering using, say, Dysport. Because that would trick the body. If your body has formed antibodies to Botox, it would trick the body into thinking that this is something different, because the antigenic properties of Botox and Dysport are slightly different, and the body might be tricked into thinking that it's dealing with a different substance and it may not attack it. And vice versa. If you've been using Dysport and you find that the duration of action is not lasting up to 3 months and it's progressively getting shorter, then that is the time to discuss with your doctor about the use of the other type of botulinum toxin, which will be Botox. So you've been using Dysport and it's not lasting long enough. At this point, you now try to do Botox and give it a try. I hope this answers the question. Thank you.